I'm Professor Neil Sargison and I'm head of the Farm Animal and Public Health section at the University of Edinburgh's Royal Dick School of Veterinary Studies. I have a particular interest in sheep health and production, and in fact I have a particular interest as well in veterinary parasitology. So I was asked to talk about health concerns that are seen in late pregnant and lambing ewes. And I was asked to focus on the sorts of diseases that we actually see around about the period of late pregnancy. In particular, diseases such as grain overload, hypocalcemia, vaginal prolapse, twin lamb disease, and listeriosis. And the main focus was to differentiate between those diseases whereby the focus needs to be on prevention and those where actually the focus has to be on treatment of individual cases. It's all very well to be talking about these specific diseases, and these are the diseases that are obvious and give an indication of the fact that the nutritional and health management of the ewes hasn't been correct. But in fact, the biggest impact of getting these things wrong are the knock-on effects on the lambing percentage itself and on the subsequent growth of the next season's crop of lambs. So the fact that the incidence of problems such as pregnancy toxemia is high is an indication of the fact that things are going wrong, and in fact the consequences of that go way beyond just those cases of pregnancy toxemia that are being seen, and they actually influence things that are actually key determinants of the productivity of the farm. So the talk was really about the need to make sure that we get the health management of late pregnant ewes right. And in order to get the health management right during late pregnancy, we've actually got to get the health management and the nutritional management right throughout the entire year and throughout the entire production cycle. So my focus was on the common health issues that occur around about lambing time, why those problems might occur, what we can do about them, and what they tell us in terms of the general health and productivity of the flock itself. When we see problems such as pregnancy toxemia occurring in late pregnant ewes, it's an indication of the fact that the nutrition and disease management of the whole group is incorrect, and the consequences go way beyond what we're seeing in these individual animals. The consequences may be the lambing percentage itself being reduced and the subsequent performance of the lambs being reduced as well. An awareness of that means that we have to look very carefully at getting the management correct throughout the entire production season, but we also have to look at monitoring what we're doing. It's important that farmers monitor the body condition score of their ewes at strategic times throughout the year, and also during late pregnancy monitor the nutritional adequacy of their animals, sometimes using metabolite concentrations. And when we identify issues with those metabolite concentrations, then we know that we need to address them in order to address the key performance indicators, which are the lambing percentage and lamb growth.